Saya berusia 28 tahun. 5 tahun yang lalu, saya merasakan ada benjolan di payudara sebelah kanan, namun saya tidak melanjutkan pemeriksaan ke dokter karena saya merasa takut. Lalu awal tahun 2020 kemarin, benjolan terasa sangat sakit dan saya juga merasakan sakit pada ketiak kanan dan kiri. Setelah di USG dokter mengatakan harus segera dioperasi karena benjolan bertambah banyak di bawah ketiak kanan dan kiri. Saya sudah mempersiapkan untuk operasi pengangkatan tumor pada payudara. Namun saat waktu operasi yang direncanakan tiba, saya tidak lagi dihubungi oleh pihak rumah sakit karena alasan pandemi. Apakah kondisi saya ini berbahaya dan bisa ditunda sampai pandemi selesai, dok? Right, I will translate the question to English. I am 28 years old. 5 years ago, I felt a lump in my right breast. But I didn't go to the doctor because I was scared. Then, at the beginning of 2020, yesterday, the lump was very painful, and I also felt pain in the right and left armpits. After the ultrasound, the doctor said that he had to immediately undergo surgery because the lumps multiplied under the right and left armpits. I have actually prepared for the surgery to remove the tumor in the breast, but when the time for the planned operation arrived, I was not contacted again by the hospital because of the pandemic. Is my condition dangerous, or can I postpone it until the pandemic is over?
My dear lady, this is a very difficult question to answer because one is not really assessing you physically. There's a few things. If you have no family history of breast cancer, okay, you are 29-year-old, and you have lump that you feel that is painful, the probability of this being breast cancer may not be really very high. Because number one, breast cancer are not so commonly, in the absence of family history, okay, are cancerous. So that's number one. Number two, most of the cancer most of the breast cancer are not painful. They are not painful. And more commonly, it could be due to a cyst or what they call infection or fibrocystic disease. All these that need to be clarified. Now, I'm surprised that if it is so urgent, I still believe, although most Indonesians have a lot of issues, that a biopsy needs to be undertaken before one is quickly go in and remove the lump. Okay, and I understand that a lot of you guys felt that we do the biopsy, the cancer spread. And I've been speaking for the past 20 years, it doesn't work that way. Because biopsy continues to be a very important part of making a decision to treat the breast cancer. So I find it a little bit unusual. Number one, you're young, you don't have family history, and the lump is painful. And if the doctor really suspects this is a cancer, I think that you warrant a biopsy before, and the biopsy result should come out in the next 1 to 2 days, before you undertaken such a large operation of removing the lump. And as you say, there's not only one, there seem to be multiple. So how many lump one is going to go and to undergo? The second question is that, do I have a better evaluation to know that this is a cancer before I do the surgery? I really do not want to do the biopsy. In some situations, if the institution is able to read a good breast MRI, they will give you quite good information about it. But I believe that the expertise of reading the MRI varies from place to place. You need to look up where is a local place that you can do this particular test. And I hope that I've helped to elevate your anxiety.
Okay. Jadi jawaban dari Dr. Wong adalah semua ini tergantung dari histori keluarga juga, apalagi di barusan pertanyaannya adalah mengenai pasien yang baru berumur 28 tahun. Ini adalah umur yang masih tergolong sangat muda untuk kanker payudara. Jadi pertama-tama Dr. Wong ingin memberitahu bahwa ada kemungkinan ini bukan kanker. Jadi harus dicek dulu apakah ini beneran kanker. Dan karena apalagi tadi disebutkan bahwa benjolannya itu sakit. Sementara dari Dr. Wong menyebutkan bahwa kanker payudara itu biasanya tidak sakit. Sehingga ada kemungkinan bahwa ini bukan kanker payudara, melainkan hanya kista. Jadi dokter menyarankan sebelum melakukan operasi untuk mengangkat benjolan tersebut, ada baiknya melakukan biopsi terlebih dahulu sebelum mengambil keputusan, apalagi operasi ini termasuk operasi yang besar. Dan dokter di Indonesia, ini adalah praktek yang biasanya dilakukan dokter di Singapura untuk menentukan apakah benjolan itu kanker atau tidak, adalah melakukan biopsi, dan hasil biopsi ini biasanya keluar dalam 1 atau 2 hari. Jadi dokter Wong sangat menyarankan untuk melakukan biopsi ini, dan apabila pasien memiliki ketakutan untuk melakukan biopsi, maka ada tindakan lain yang disarankan, yaitu MRI. Tapi MRI ini juga tidak seefisien biopsi untuk mendeteksi kanker. Jadi ini tergantung bagaimana dokter membaca MRI tersebut. Ya, semoga menjawab pertanyaan tersebut.